Part of what I like about child neurology is seeing a huge variety of patients.
Vanderbilt is a place where you will get great training, but also they'll push you to your potential.
The faculty from the top down are really invested in every single resident learning to be a good pediatrician, and in our department being a good child neurologist.
The ideal resident in our program would be someone who's curious, who's caring, who's also can be humble to know that while we have knowledge, there's so much we don't know yet. Someone who, of course, is going to be a great physician and a great resident in our program, but I really want them to be an exceptional human being because those are the people we work with.
Our residents get an excellent education in pediatric neurology in a variety of ways during their time at Vanderbilt. They get excellent clinical exposure through our clinics and our inpatient side. And then additionally, they have numerous opportunities to work with subspecialists to broaden their clinical exposure.
But also we want you to become a leader in patient care, a leader in scientific discovery, a leader in education. All of these aspects are super important to our field.
I have my own continuity clinic, which is nice because we start our continuity clinics as second years here, so you get to build up a pretty good group of your own patients.
We spend a lot of time doing all different specialty clinics.
I am the section head for pediatric epilepsy within our division of pediatric neurology. Both the pediatric and adult neurology residents spend time reading EEGs, both in a formal setting where they're on an EEG rotation, as well as didactics that are sprinkled throughout the year. And in my world specifically, I know you're going to get an amazing EEG education where you'll be able to go out in the world and feel very comfortable reading and interpreting EEGs on your own.
I work specifically in our neurogenetics clinic, working to diagnose children with neurogenetic disorders. Vanderbilt is honored to be a part of the Undiagnosed Disease Network. There are approximately 6 clinical sites across the country where we see patients who have had extensive evaluations for presumed genetic diagnosis.
The research opportunities at Vanderbilt are really limitless. Vanderbilt Department of Pediatrics has some of the highest levels of NIH funding of anywhere in the United States.
We encourage research opportunities to be done for all of our residents and have elective time built in. That can be something as a clinical research project. It can even be in a basic science laboratory.
We have a NIH-funded clinical and translational research program, BioView, which is Vanderbilt's biorepository. One of the special things about our Vanderbilt program is our commitment to mentorship. We are interested in you becoming the kind of neurologist that you want to be.
You're surrounded by a lot of these well-renowned physicians, but in the hospital, in the clinics, they're so approachable. You can ask them questions, you can text them.
Everyone is very welcoming. All of the faculty are fantastic. They're so passionate about what they do, and that's really contagious. It spills over.
Everyone is so invested in education, and I think that's a really big deal, and that's something that I for sure haven't taken for granted.
People always say our child neurology program is rather like a big family. We care about each other, and we really want to bring out the best in each other.
There's this nice combination of it kind of has the almost small hospital feel in the sense that there's a lot of camaraderie, everyone knows each other, everyone's really nice, but then you have all the resources and the opportunities that come at being a major children's hospital.
During my residency, we've definitely had plenty of time to kind of explore what we want to do in medicine.
Since my time at Vanderbilt, I have found that I am very interested in global health work, and throughout my residency training, I've had some opportunities to work with hospitals in Africa, which has given me some invaluable experiences that I think have been very beneficial to my training.
So I think being a child neurology resident here at Vanderbilt, you're not going to miss out on anything. You're going to get great people, you're going to get great lectures, you're going to see and learn a lot from patients. You're going to get great weather, and the city of Nashville is growing and busy and fun. I mean, in a nutshell, it's the perfect place to be.